morning. Welcome back to the Healthy Aging in Neighborhoods of Diversity Across the Lifespan study, also called HANDLS. The National Institute on Aging supports the HANDLS study as part of their mission in the National Institutes of Health and the Department of Health and Human Services. Our goal is to study the rate of change in health as people grow older. As a HANDLS participant, you will contribute to our understanding of the health issues, problems, and concerns in neighborhoods all over Baltimore. We thank you for coming back to take part in the next phase of the HANDLS study. You may remember that a few years ago, you were invited to participate in HANDLS when we were selecting residents from Baltimore City neighborhoods. We interviewed you in your home, and then you were examined on our mobile medical research vehicles. It is time for us to return to your neighborhood for the first follow-up examination. You will notice that some of the tests are the same as the last time you were here. There are also some new tests and questionnaires that may seem unfamiliar. We called this phase of the study HANDLS Wave 3. We will collect Wave 3 information in two parts. We will ask you to consent for each part of the study separately. The first part of HANDLS Wave 3 will require you to spend several hours in our mobile medical research vehicles, or MRVs, for examinations. We will ask you to update your medical history since your last examination. We will also provide a comprehensive physical examination. We will ask you to remember all of the food you ate the day before your appointment. We will assess your muscle strength and bone density. We will examine the blood flow in your heart, and we will examine the valves in your heart to see if they are leaking. We will also draw your blood and collect tissue and urine samples. We will ask questions about your physical activity, household structure, and mental health symptoms. We will also examine your ability to listen, concentrate, discover, and remember new information. The second part of Wave 3 consists of an hour interview on the telephone. We will schedule the time for you at the end of your visit today. During the telephone interview, we will ask you to recall all the food you ate the day before. We will ask questions about your daily activities, how you use of healthcare services, and any income or employment changes you have had since your last examination. The medical research vehicles are comfortable year-round. They are handicap accessible and provide privacy for exams and interviews. We will serve you a light breakfast and lunch while you are on our vehicles. After your blood has been drawn, you will be escorted to the testing stations that make up the day of evaluations. If you want it, we will provide transportation to and from the medical research vehicles. We have limited space on our vehicles, so we only have room for participants while we are examining them. We do not have space for anyone to accompany you during your examination. Blood tests. We perform blood tests to look for blood disorders such as anemia, diabetes mellitus, thyroid disease, liver disease, hepatitis, prostate disease, and kidney function. Some blood samples will be used to look at genes that may play a role in age-related diseases like Alzheimer's disease, heart failure, high blood pressure, and cancer. Medical history and physical examination. The medical history will help us understand your lifestyle and habits and the medical problems you have had within the last 5 years. It will also tell us about your health and your risk for some diseases in the future. You will be asked questions about medications you are taking. We will go over your medical history before your physical examination. Our physician will check your blood pressure and examine your heart, lungs, abdomen, and skin for any abnormalities. Our physician will inform you of the results from the physical exam. If there are any abnormalities discovered by the comprehensive exam, you will be notified. If you sign a medical release, we will forward the results to your physician for follow-up care. Physical Performance Battery. The Physical Performance Battery helps us check muscle strength and functioning. It may also tell us how you may be affected by disease and disability as you grow older. Grip strength is used to measure upper body muscle function. It can also help us determine your degree of frailty. We measure upper body strength through grip strength in both hands by using an adjustable hydraulic dynamometer. For the lower body measures, you will be asked to stand and perform several movements. Each test is timed and has a different level of difficulty in order to help us assess your leg strength and balance. Dietary recall interview. During this interview, we will ask you to remember all the foods and beverages you consumed in the past 24 hours before your visit with us. We will have some cups and measures to help you remember the amounts. Bone and body scan. Bone density tells us about the risk of your bones breaking easily as you grow older. You will be asked to lie down on a DEXA scanner. This lets us see the quality of the bones in your lower back and hips by using small amounts of X-ray radiation to take pictures of your body. It also measures the amount of fat and muscle. You will receive a small dose of radiation with this test. The radiation that you will receive is similar to what you would be exposed to from standing in the sun. Women between the ages of 30 and 55 are required to take a pregnancy test before participating in this test. Echocardiogram. An echocardiogram is an ultrasound test that is used to examine the structure and function of the heart. We will measure the size of the chambers of the heart, the thickness of the walls, and the function of the chambers as the heart pumps. We will also examine how well the heart valves work as they open and close. An ultrasound sensor is placed on the chest over the heart. The echo sound waves produce images on the monitor. These images show the action of the chambers and valves of the heart. This test does not use any radiation. Memory testing. This interview is to see how your thinking, memory, and mood change as you age. We will ask you to remember words, numbers, and pictures. We will ask you to pronounce words or to think of words from certain categories. We will also ask you to pick out the same object twice and imagine how objects look in different positions. Wrap up. We will compensate you for your time at the end of your visit to our medical research vehicles. We will also compensate you after we complete your telephone interview. We will send you a report with the results from your physical, blood and urine test, electrocardiogram, and the bone and body scan. We encourage you to share these results with your doctor, especially if there are abnormal findings. If you do not have a healthcare provider and you would like one, we will assist you in getting follow-up care. Some of the long-term goals of HANDLS are to discover if we can pinpoint the causes of good health in Baltimore's neighborhoods, to gain a better understanding of some of the diseases related to aging, to study why some people are healthier than others as they get older, to study how health changes by looking at the same people over many years, and to look at the effects of income on health. Learning about aging is a long-term process. This is why the HANDLS staff will return to your neighborhood every several years to follow your overall change in health and lifestyle.